Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. While 11.3% of the U.S. population has diabetes, it's estimated as much as 18% of West Virginia adults have the disease. That means about 260,000 West Virginians have been diagnosed with diabetes, but it's estimated another 65,000 have it and don't know it. Those are high numbers, but that doesn't mean we can't do something about them. So today we're talking about everything you need to know about preventing and treating prediabetes and diabetes with WVU Medicine endocrinologist Dr. Jessica Perini. Welcome, Dr. Perini, to Live Healthy West Virginia.
Thank you so much for inviting me. I'm looking forward to it.
It's great to have you here. We got a lot of ground to cover today, don't we?
Yes.
So those are very high numbers we were just talking about.
Mm-hmm.
Are we facing a diabetes health crisis in West Virginia?
Yes. I mean, it is a large number. There are a lot of people with diabetes. It isn't something new. We have known that West Virginians have diabetes in, high rates of it for a number of years. And we are aware of the high risk for the population in general. And there are programs in the state working to try to reach out to different communities to try to provide information and education and help, but it's definitely still a big problem.
Okay. Well, hopefully we're going to help solve that today. Mm-hmm.
Fix it.
Yes, we're going to fix it in 20 minutes. So what are the different kinds of diabetes, starting with prediabetes?
Mm-hmm. So prediabetes is a term that we all use to indicate a situation prior to developing official diabetes based on numbers. Medically, the term prediabetes isn't an official term, but it is something even medical care providers use to talk about a group of people with sugar numbers that are in this critical range where they are considered to be at risk for moving on to develop diabetes in the future.
Okay.
So prediabetes means your sugars are not completely normal.
Mm-hmm.
And by normal, and when we measure, that means a certain cutoff number for sugars fasting before you've eaten, and a sugar cutoff number when you have eaten something or in any non-fasting time. So there are gray zones between normal sugars and sugars that are above these cutoffs where we say you have diabetes. So prediabetes is sugar falling in that range when people are at risk for moving on to develop diabetes.
Okay.
The most common type of diabetes is type 2 diabetes. And about 90% of all people with diabetes of any age in any part of the world, that's type 2 diabetes, the most common kind. And that's the kind that most of the time people develop as they're adults. As they get older, it's influenced by how much we weigh, how active we are. And most of the medications that you hear about are designed to treat type 2 diabetes.
Okay.
And then there's type 1 diabetes that we used to call juvenile onset diabetes.
Yeah.
And that's because we used to think really it was mainly children who developed it. But now we know that adults can also develop type 1 diabetes at any age. And so we don't call it juvenile onset anymore. We call it type 1 diabetes. And that is maybe around 5 or 6% of all diabetes. And it is an autoimmune problem where your own immune system kind of looks at the cells in your pancreas that make insulin, and your immune system thinks there's the target, and it kind of kills off those insulin producing cells in the pancreas.
Wow.
And that's when someone develops type 1 diabetes.
Okay. And I've read about what some experts are calling type 3 diabetes.
Mm-hmm. So that's also not a formal term.
Mm-hmm.
However, It does refer specifically to a type of diabetes that's neither type 1 nor type 2, that refers to when some other problem affects our pancreas and makes it unable to produce insulin. So, for example, a person who has inflammation in their pancreas repeatedly, pancreatitis is the official name. And so with that inflammation in their pancreas, those cells that are supposed to make insulin cannot make insulin. And so then you have type 3 diabetes or pancreatogenic diabetes.
And I thought I read there are some camps that consider Alzheimer's disease to be type 3 diabetes.
Yeah, that's sort of a newest kind of thinking out in the world. And again, it's not so much of an official term or an official diagnosis, but it is something to be aware of, that again, a certain population needs to be monitored for development of high blood sugars. And so although terminology can be argued about whether it's a real term or not, anything that kind of brings things to the forefront so that we think to look out for people and make sure that if they do develop any kind of diabetes, we're aware of it and can help them.
Okay. So let's talk about each of these types, and let's start at the beginning with prediabetes. What causes prediabetes? Is this kind of self-inflicted?
So a lot of diabetes, particularly type 2, which is the kind that prediabetes, if it evolves or progresses into diabetes, becomes, is genetic. It isn't the biggest cause of type 2 diabetes, but it does have a huge impact on whether or not somebody will develop problems that lead to diabetes. So prediabetes, again, this early phase of sugars that are a little higher than normal. The risk factors mainly are kind of chronic inactivity. You know, if you have a week or two where you're sick and you're laid up and you don't want to do anything, that isn't going to lead to prediabetes. But if you're someone who really chronically doesn't exercise or move around a lot, that's considered to be a risk factor. Being overweight or obese with a BMI that's elevated, that's considered to be a risk factor. Poor diet can contribute to this. And, you know, so if you think of it, are we bringing this on ourselves? It, to some extent, includes things we could do to work against to try to keep our risk for prediabetes down. So if you aren't someone who's very active, try to get up and march in place in front of a 30-minute TV show in your living room. Or if you find that you tend to eat less healthy foods, try to have fewer processed foods and fewer sugary beverages. Things like that will definitely help.
Does prediabetes always lead to type 2 diabetes? I mean, can you turn it around before it gets there?
You can. So again, working towards those efforts that help keep your BMI moving in a healthy direction or keeping it within a good range, a healthy range for normal weight or lower end of the overweight range for BMI, definitely can help you not progress to type 2 diabetes, and eating better, healthier foods, lower in carbohydrate, and being more active. You know, so lots of things you can do, and your sugars do not have to progress to type 2 diabetes levels.
So you don't have to just accept it. You can actually take action in your own hands.
Correct.
Are there any symptoms? I mean, does prediabetes have symptoms that we can watch for?
Generally not anything obvious.
Yeah.
So,
Great.
Right, exactly. It's really just kind of, I mean, you can do labs, blood tests, and see numbers that would let you know that, in fact, you are in that prediabetes range. So a hemoglobin A1C is a classic blood test that we use to monitor average blood sugars over time in people who have diabetes. but there is a range of A1C that indicates that someone has prediabetes. So getting screened when you're, if you have a bunch of risk factors, you should be having that lab done generally. And age also is considered a risk factor for developing prediabetes and going on to develop type 2 diabetes. As we get older, the risk increases. So having an A1C done at your provider's office, if you're at risk, is something that can tell you if you in fact have prediabetes or diabetes. Fasting blood sugars are commonly done on standard routine blood tests, and seeing what that level is another way to know if your sugars are higher than they should be. But not too commonly are we having symptoms that clearly say, ooh, I think my sugar's higher than it should be. I better go get checked.
But it wouldn't hurt to remind our PCP.
Correct.
Yeah.
Correct.
Yeah. Is there any way to prevent prediabetes?
So having parents that don't have it is one thing, because genetics does, certainly play a role. Keeping your weight under control, staying active, and just trying to have a healthier diet. It doesn't have to always be healthy, but, if it's predominantly processed foods and sugary foods, then trying to maybe make that a smaller percentage of the types of things that you eat.
I see a pattern here.
It's true.
I see a pattern.
It's true.
How do we treat prediabetes? Do you necessarily have to go on medication if you're diagnosed with prediabetes?
No. In fact, lifestyle changes are fundamentally the first step. And there are certainly medicines that can help our bodies kind of handle the insulin we do make before we start resisting the insulin's effect and seeing sugars starting to rise. So some old-fashioned medicines that can help are metformin. It's a diabetes medicine that can also help in, keeping sugars under better control for longer.
Okay.
Excuse me.
Here, have some water. It's a good time for a water break.
There is a medicine called pioglitazone, also a very old-fashioned diabetes medicine that, you shouldn't use if you're pregnant or anything like that, but that also can help us stave off the progression to overt diabetes. The new class of GLPs they also can help us keep our weight down. If we're eating a little less, then we're also less likely to be eating the bad foods. So so the GLP-1s, that's okay. While we're on the topic of GLP-1s,
can they prevent or reverse prediabetes or even type 2 diabetes?
So for prediabetes, I would say it's safer to say yes, it can reverse prediabetes. Once somebody has been officially diagnosed with diabetes, type 2 being the type I'm going to talk about with GLPs. Once you've been diagnosed with type 2 diabetes, you can definitely improve your sugars like crazy to a point where they are in normal range, not in the range where we would say they count as in the diabetes range.
Oh, wow.
However, if a person regains weight or starts eating poorly, they will get right back to their starting point, most likely. Whereas a person who didn't have diabetes but was overweight, uses a GLP, they get their weight down, they could regain their weight and not necessarily develop high sugars. So to say that these medicines can get rid of diabetes is something I would hesitate to say, because you can go back right into it.
Okay.
Whereas if you didn't have diabetes, you can lose weight and regain, and you still may not have diabetes. So it isn't just the weight loss, for example.
Okay. So that pattern, no sedentary lifestyle, exercise, try to avoid processed foods,
Yeah.
healthier diet.
Yeah, and it's impossible to completely avoid things.
It is.
So,
It is.
Nobody will always avoid everything that's not the greatest for them. That's okay. It just should become a smaller proportion of what they're consuming.
Baby steps.
Mm-hmm.
Yeah. So as far as type 2 diabetes is concerned, are there any symptoms that we may see and feel since it's a little further along than prediabetes?
Yeah. So if you've been monitoring from the time suppose you were diagnosed with prediabetes and somebody's monitoring closely, chances are good you won't develop too many symptoms because you'll be working on keeping that progression to as slow of a process as possible. But there are plenty of people who are only diagnosed because they have symptoms. And classic symptoms include feeling thirsty all the time, and really all the time, including at night when you're sleeping. You might wake up and feel like your mouth is so dry, you need to drink some water, urinating more than seems normal. And also sometimes people have an increase in their appetite. And a lot of this is driven by the fact that as your sugars are high, your body's trying to get those sugars lower. One of the ways it does that is to try to push that sugar out through your urine. So you can't urinate out sugar crystals, of course. Right. So you pull water out with the sugar, and so you become dehydrated. And then that makes you very thirsty. As you're losing sugar, you're losing calories and energy. So your body compensates for that by stimulating appetite so that you go out and try to find more supply.
Right.
Because you're losing sugar through your urine, people often are losing weight. If it's been a while that they've had really quite high sugars untreated, then they may start losing weight without any effort. Ooh. And for some people, that slows down how quickly they go to the doctor to find out what's wrong, because they think, you get diabetes if you're gaining weight, so I can't have diabetes because I'm losing weight. And in fact, the weight loss is sometimes one of those classic findings when somebody comes in and their sugars are just really high.
You've got to stay on top of it. You can't make any assumptions.
Right.
Stay connected to your doctor, obviously. Are there, as far as medications go, what are the treatments for type 2 diabetes in addition to, that healthy pattern we were talking about, lifestyle changes?
Yeah. So, of course, lifestyle is important fundamentally. Another thing is medications. And we know that the sooner you jump on those high sugars, the more aggressively you jump on them earlier on, the better off that person's body will be over the years, even if down the road their sugars kind of become less well controlled. Jumping on it right at the beginning is really important. And so there are various guidelines out there that anyone has access to if they can access the internet, for example. So the American Diabetes Association, goes through what should you do if your sugars are high. There are other societies that put out their algorithms, and if you have high sugars, do this first, do that second, do that third. They all start with lifestyle. Yep. And then the next thing is going to be something like metformin, plus the GLPs are now considered a first-line treatment for type 2 diabetes because they're so effective in helping control sugars right off the bat. So if somebody, in fact, does get diagnosed with diabetes and they're told to wait and come back in 3 months and try X, Y, and Z, and then one medicine gets started and then 3 more months go by, I would encourage them to encourage their provider to be more aggressive about fixing their sugars right away. Don't wait. Start on metformin and a GLP if you can right away to get your sugars as close to normal as you can early on, rather than hoping to eat better and try one and then adjust the dose. It's much better to be aggressive at the beginning, avoiding the risk of low blood sugars. You don't want to overcompensate, but that does help the body kind of heal itself a little bit better so that down the road, the slightly high sugars will do less damage to the body.
Is that like preventing cumulative damage?
It is a way to think about it. Yeah.
Okay.
So
okay, that makes
that's
sense.
not to say that everyone who kind of had a slow addition of medicines on over time is going to have bad outcomes or bad consequences, but it is a good strategy to really try to fix sugars early on if possible.
If you're on medication, you're diagnosed with type 2,
Mm-hmm.
you're on medication, can you reverse type 2 diabetes with lifestyle changes and medication to the point where you don't have to take the medication anymore?
Certainly it's possible to get your sugars back down, but kind of hearkening back to something I said earlier, if somebody doesn't have diabetes, they can go eat birthday cake and their sugars will not go above a certain threshold.
Mm-hmm.
Someone who's controlling their sugars with diet and exercise can't go have that same piece of cake without having their sugars go up.
Okay.
So there's a fundamental difference.
Okay.
And if they don't eat cake, great. I mean, fine. Their sugars won't go up.
Right, right.
But it's hard never to have that.
Yeah, I was just going to say I couldn't do that.
Yeah. So, but there are a lot of new medicines in general that we didn't used to have at all that really help not just with sugars, but other things that come along with type 2 diabetes, like
let's talk about that. What are
disease
considered
and strokes.
Yeah. What are these latest, greatest treatments for type 2 diabetes?
Yeah. So the GLPs are definitely a fundamentally good tool. And it's not just because they help keep sugars better, but they help with weight gain. They also have been shown to help reduce certain risks of heart disease, strokes, and even certain kidney problems that can come with diabetes. And another newer class as well is SGLT2 inhibitors. So a generic form of that would be empagliflozin, for example. These are once-a-day pills.
Okay.
They also have been shown to help people who have diabetes fundamentally, but they may help people lose a little bit of weight. And they have been helpful in people who have congestive heart failure and stroke and also kidney problems. So there's all sorts of good things that are out there now that are available that we didn't have that address some of the outlying effects of diabetes.
Yeah.
So you can kill multiple birds with one or two stones.
Yeah.
And it's something that we didn't have more, 20 years ago, say.
Well, that's good to know too.
Mm-hmm.
Let's talk about type 1 diabetes. I think that's the only one we haven't talked about yet.
Mm-hmm.
You mentioned earlier that it used to be considered, you only got that when you were a child, but you can get it as an adult.
Mm-hmm.
What are there symptoms to look for that you're developing type 1 diabetes?
So there aren't symptoms, official symptoms, till you have high sugars. As far as wondering if you are at an increased risk for developing type 1 diabetes, the risks would include things such as, do my first degree family members have type 1 diabetes? So my parents or siblings or my children, because then your chance of developing type 1 does increase. If you have one autoimmune condition already, so that means things like rheumatoid arthritis or lupus or ulcerative colitis, things like that, then a person is a little bit more likely to develop some second autoimmune condition.
Okay.
And type 1 diabetes is an autoimmune condition, so it could be in there with something that person is at risk for developing.
Okay.
So, yeah, there are certain blood tests. This is something that is kind of new in the world of type 1 diabetes. Because of all of the investigation into medications that affect our immune system, these immunologic medications, you see them on TV all the time for treating autoimmune conditions or treating cancers. They're all helping our immune system in some way do or not do things.
Yes.
And so if there is a family, for example, who has a high rate of type 1 diabetes, someone who doesn't have diabetes can go and get blood tests looking for their certain parts of their immune system that can be measured in their blood, called antibodies, that if they're present in that person's blood are potentially going to attack that person's pancreas and kill off those insulin producing cells. So if you can measure those antibodies in a person's blood who is at risk, there is a medication that can be tried to see if it can delay when that person might develop type 1 diabetes. Okay. So that's something
so we can find it earlier and maybe slow down progression earlier.
Or the onset of the disease itself.
Wow.
So, yep.
That's a lot.
But
that's a lot.
Very often, so for people who have type 2 diabetes, there are risk factors that are a little bit more than those that lead somebody to develop prediabetes. So for example, if a person has the other things we did talk about, increased BMI or bad diet or sedentary lifestyle, if they have a family history, if they have high blood pressure, if they have a low HDL in their cholesterol numbers, that's the good cholesterol, if that's lower than it should be. If they had a history of gestational diabetes, which is the kind that you get just when you're pregnant, you didn't have diabetes before that, oftentimes it goes away after delivery, or people who have polycystic ovary syndromes, PCOS, things like that are risk factors for developing type 2, and for those people, they often have sugars that are a little bit higher than normal, prediabetes, for many, many years. And like you said at the beginning, a lot of people don't even know that they have any kind of sugar issue. And so by the time they're diagnosed with type 2 diabetes, they've had some degree of high sugars, potentially for decades. And that's been working away at their body. People who develop type 1 diabetes, on the other hand, unless they have a family history of it and are kind of knowing that they need to monitor, most of the time it just happens out of the blue. And it's not completely true, but I kind of say we can tell you the day or the month that they developed diabetes because the symptoms come on very rapidly.
Wow.
Those antibodies, the immune system parts that are attacking those cells in the pancreas, they attack them, and then you have no insulin and your sugars go up. So this can happen very quickly. And so people develop those symptoms of feeling thirsty, urinating a lot. Maybe they're losing weight, they're hungry. And sometimes because sugars are so high or fluctuating a lot, they get blurry vision. And, so that happens, and it's so out of the blue that they present to the emergency room and we find it right away, and they didn't know what was going on. So for those people, we kind of know, okay, now here you are, you have diabetes.
We need to be aware. We need to be aware. So I want you to talk a little bit about the expertise of the endocrinology team at WVU Medicine in fighting this diabetes battle. It's a big one.
It is. And we've been increasing the number of endocrinologists like crazy. Just maybe 10 years ago or 15 years ago, I think there were 3 or 4 of us. And now there are 12 or 13 endocrinologists, and there will, in the next year or so, be 15 to 18, I believe. We have many nurse practitioners and people who provide excellent care for people with diabetes.
Yeah.
And we have diabetes education specialists in the clinic and pharmacists and all sorts of people there who are trained and well-versed in managing diabetes and high sugars. Everything from prediabetes to 20 years of, bad sugars.
Yeah.
So, and we prescribe all the different medications. We all use insulin pumps and continuous glucose monitors for our patients who want to. And so it's a good place to come because you get a lot of services right there. And we also even do telemedicine. So people who can't drive to Morgantown, we see them on a video screen and help them that way.
So it's excellent care as close to home as possible.
Mm-hmm. Yep.
That's great. So before we go, I always like to ask, what's the most important thing we need to know about preventing and treating diabetes?
Mm-hmm. So I would say that as far as prevention goes, if you know that you tend not to be too active, there are a lot of ways to just move a little bit more. It doesn't need to be a formal exercise routine. It doesn't have to be that you join a gym. You can, and it shouldn't depend on the weather. I walk, but it's cold out. So walk around your house or up and down your steps, or if you're afraid of falling, but you want to do steps, hold the railing and just go up and down 2 of them.
Yeah.
It's fine. And do that for 5 minutes for the first week. Do it for 10 minutes the second week. Build up your tolerance and you'll become healthier. As far as diet, it's sometimes difficult for people to eat what's traditionally called healthy food. And sometimes we just don't have access to it, or we don't really like it, or it's just not our habit. But trying to replace a few of the processed types of foods with a few maybe more whole foods and whole grains and things like that. Little steps count, and you can kind of build on that over time. And then keeping weight under control. It isn't so much going to the gym as it is seeing how much you're eating. And we all eat more than we realize.
Yep.
And it's very difficult to lose weight. But we also have a medical weight loss center here at WVU that we work closely with, and they really do a great job. But it is a hard thing to lose weight. There's no doubt about it. And the GLP medications that can help with weight loss are oftentimes hard to access for whatever reason. But those do work very well. So working on those things is a great strategy.
Okay.
And then working with your primary care provider and just letting them know you're concerned. They should be concerned and kind of anticipating and checking your A1C or your fasting glucose level and asking about your personal medical history and seeing if you're higher risk than somebody else on the street, and making sure they are looking out for you and starting you early on something that can prevent the progression of diabetes is a really important thing.
Okay.
And I would encourage people to do that.
Well, thank you so much for sharing all this information. I know we covered a lot of ground, but it has to be covered. I mean, just the burden of this disease in this state, we're not going to lose the battle.
Yep, that's right.
Well, thank you. So that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information about diabetes, visit wvumedicine.org/diabetesed. To find the latest episode of Live Healthy West Virginia, follow us on our YouTube channel at youtube.com/WVU Medicine and click on the Live Healthy West Virginia playlist, or search WVU Medicine to follow us on Spotify to find this podcast and all WVU Medicine podcasts. I'm Mary Ravazio Menard, and on behalf of Dr. Perini and everyone at WVU Medicine, thanks for joining us.